One thing that's been really exciting is seeing the way that the community kind of across different stakeholder groups has come together to create that access. So looking at opportunities to engage manufacturers, to engage local governments, different advocates and advocacy organizations, the private sector, the public sector, and really all of those global stakeholders that it takes to address things like pricing or things like data, or come together and share, different examples of learning from one country to another, from one facility to another, I think is something that the hormonal IUD scale up has really benefited from.
The idea is to have women across the globe have the same advantage of having access to a contraceptive method that they like, having access to a broad range of choice. So it's not just a few methods, but it's the wide range of methods, depending on what really works for them at any particular stage in their lives.
And we saw from the pilot studies in low and middle income countries that some women who had never used any other modern method were enthusiastic about using the hormonal IUD, and many women who were using less effective short-term methods that require a lot of effort on their part, like taking a pill every day, were very interested in using the hormonal IUD.
One of the really exciting aspects to the hormonal IUD is in other non-contraceptive indications. For example, heavy menstrual bleeding. As a satisfied HIUD user, that's primarily why I chose it. And I do think that it's going to be a really compelling reason for many women to choose the method. So as the market grows and we start to understand that dynamic better, hopefully we'll continue to see increased access and affordability.
We have a number of women who really have challenges with heavy bleeding. So when you tell them about the benefit of reduced bleeding, they get very excited. It's one of those things that women want the hormonal IUD for.
There's a study ongoing right now in Kenya that is looking at whether the hormonal IUD might be able to address anemia in women who have mild or moderate anemia. And so that could be another use for this product.
So when we talk about, introducing a contraceptive method, we often talk about that in a silo. We're thinking about family planning specifically. And I think the side benefit of reduced menstrual bleeding, or little to no menstrual bleeding for a lot of end users, challenges us as a community to think about products in a way that's much more inclusive and much more kind of across that continuum of care. So that when we're counseling end users, it's not just, I want this method to prevent pregnancy, but also I want a method to prevent pregnancy and manage menstrual bleeding and manage a menstrual disorder. And I think that's super powerful.
Women are counseled on when they come to access hormonal IUD is that they're counseled that there could be some pain, and they're advised on how to manage it with some painkillers. Of course, they are told that it doesn't happen for each and every person. We are different, so they might feel differently. And so in case they feel it, then they know that they need to manage it with some painkillers. And in some facilities, it is made available for them as they go. And in other facilities where it's not available, then they are told where they can obtain it. So that awareness that they will experience some pain and how to manage that pain then becomes a very good way of managing the pain and dealing with the pain.
Once the woman has chosen the method, it's important for the provider to give her the options available for pain management, the benefits of the options, the risks, and the alternate techniques present. And also, the pain management should be included in the training tools and counseling messages to really take this forward.
I think it's important to explain all the different options available so women are more confident of what to do in case they feel pain.
In order for this to happen, we have to ensure that the medications are available. The providers are trained in actually giving the paracervical or applying the creams and the gels in order for it to be to make it happen. And I think that's a major step.
When we talk about reproductive health supplies, we should also be talking about pain management, whether that is for the insertion of a hormonal IUD, whether that is for menstrual cramping and regulation of menstrual cramping, and whether that's for other pain associated with the insertion or removal of other methods. I think it's a really important part of the conversation and really responsive to the needs of the end user.
Method choice allows us to choose whatever we want, and having those different brands is also part of that enhancing the method choice. I don't have to go for one brand if I have a variety of brands, and if the brands are different or if they're the same or different, and the fact that they are available, I think that expands method choice.
When it comes to uptake and choices for a woman's reproductive health, we often see that in many cultures it is a joint decision. And we've already heard by some of the research that's been done by various implementing partners the misconceptions that sit with men. So to the degree possible, how any of the investments that can be made to sensitize not only men but community members generally, I think is going to be very important for being able to reach women with the choices that they want.
Around data, I think we often overlook the importance of data when we're thinking about scale up, but recent efforts to disaggregate hormonal IUD data from the copper IUD data to make sure that we understand, where is the demand, where are we seeing people try to scale access, are we able to plan the supply chain in a way that matches that demand, and really just coming together around that data, again, kind of through that collective action kind of lens, I think has been really exciting.
In Kenya, we've faced inconsistent supplies. There are times when a client will go to the facility and not find the method, and so that then interferes. If we could have consistent supply of the commodity, that would also make a very big difference.
So the hormonal IUD is, although the initial cost of the product and the services to insert the IUD is more expensive than other methods, in the long term, it is a very cost-effective method. So if you think about, for example, once it's inserted, it does not require anything more from the woman for many years or from the health system.
It's been done, but it's not sufficient because we still have a number of women and even the community at large who don't know about the hormonal IUD. And you see, when they don't know about it out in the community, they won't even ask about it when they come to the facility. So it would be good if we can intensify efforts on awareness creation.
Well, there is lack of consumer awareness, but there's also lack of awareness among providers and real understanding of just not only the product, but the benefits of those products, right?
One of the things that I am really impressed by and encouraged by in relation to the work around introduction of the hormonal IUD is how the broad family planning community, if you will, has coalesced. So the Hormonal IUD Access Group, which has brought together country governments, the suppliers, donors, researchers, organizations doing service delivery and advocacy and policy work, all of those groups have been brought together with this goal of bringing this really effective method to low and middle income countries to increase access for women. And I think it's been very gratifying to see how these groups, who may not always have the same interests or may have different ideas about the approaches that should be used, but how everybody has come together. And I really, I don't believe we would be where we are now with the introduction if all of these different groups of people had not come together and work together under the leadership of and guidance of the Hormonal IUD Access Group.